Welcome to Lesson 5 on this team course on dental occlusion, specifically looking at the temporomandibular joints. And I'm going to take a few minutes to talk about this term that we call centric relation. If we're talking about joints, it's got to come up. And so really, let's go right into it. What is centric relation? Well, centric relation is the position of the condyle when the lateral pterygoid is relaxed and the elevator muscles contract, right? It's when the disc is properly aligned. So let's go over that again. It's when that sideways muscle that we talked about when we talked about muscles releases. When the elevator muscles are flexing and the ball is in the socket with the disc in there. So it's just when everything is in its orthopedically stable position. So when we talk about centric relation, it's really just an orthopedically stable position. Ball in socket, muscles doing what they're supposed to do, and that's really about all it is. So why do we talk about centric relation so much? And maybe why do you hear about it in your practice? Well, you know, it's really initially for records, because what we talk about is that every record, if we're going to evaluate somebody's occlusion, every record should be taken in a centric relation position, because otherwise we're not going to be able to evaluate all the rest of the movements of the mandible. So let's take a closer look at what I mean by that. So when you bite on your back teeth right now, you may feel like all of your teeth are touching pretty good. They're interdigitating pretty well, right? And you can move your jaw in any direction. But there's a distinct possibility that as you're biting on your back teeth, the ball is just slightly out of the socket, just a little bit. And so there's a potential that when the ball actually seats into the socket, that you can get some other teeth touching that you don't usually feel touching, and oftentimes it's actually back teeth. So it's almost like you have two bites. A bite that where your teeth touch when the ball is seated properly in the socket, and sometimes that's only that back tooth, and as you watch this video you can see that here. And then you have your bite when you bring your teeth forward just a little bit and they really interdigitate and everything feels really good, but yet the ball is slightly out of the socket. And so centric relation would actually be where your teeth are touching with the ball in the socket, with the pterygoids released, with the disc properly in place. So why is that so important for us in dentistry? Because if we're using the joints to guide our path of closure in our teeth, everything becomes more predictable, right? The advantages are immense because it's almost like a hinge. It's like opening and closing your door. Every time you open and close it, you don't have to think how it's going to close. You know it's going to close together the same every time. Well, that's the same if we know that the ball is in the socket and when it hinges closed, then every time we come together, our bite is going to be more reproducible because we have the same hinge every time. It's going to have no interferences because it's just this smooth gliding hinge. And more importantly, it's actually really convenient because we can do dentistry on multiple teeth or one teeth, always knowing that we're going to be in the same place. So again, everything becomes more predictable. We're not chasing a bite, trying to do dentistry, not knowing where our teeth are going to come together today, different from tomorrow, because it's that same hinge as the door that we walked in and out of in our house this morning. We knew the door was going to open and close the same, and so we could do anything we want on either side of it. It's the same with this. If we can actually have all of our teeth touching with the ball in the socket on a regular basis, all of dentistry gets a little bit more predictable. So then, what are the disadvantages of this thing we're calling centric relation? Well, first of all, it requires some knowledge of the temporomandibular joint. Well, I'm guessing if you're watching this and your doctor is asking you to watch this, or you're watching it all together, that's what we're doing right now. So we're taking that out of play a little bit. You also have to understand that we need to manage the muscles first, which is why we have a course on muscles, and you can start to appreciate the squeezer muscles and the stabilizing muscles and that darn lateral pterygoid again. So we have a nice understanding of that. So those are really the disadvantages of centric occlusion. So we should probably spend a minute then, because we're pumping this whole centric relation thing, let's spend a minute and talk about what centric relation is not. It is not magical. If we restore a patient in centric relation or understand what centric relation is, it doesn't make everything better. It doesn't make all the dentistry in the office perfect, but it sure makes it a lot easier. It's also not forever, because even if we do restore a patient in centric relation or understand what it's all about, we're still human beings, right? And things are going to change. We wear and tear a little bit, and that's the dilemma. It's still a moving target. It's just less of a moving target as not taking it into consideration. And finally, what it's not, it is not necessary for every patient. The majority of our patients are functioning just fine in maximum intercuspation with their body compensating really well for our inefficiencies. So it's not for every patient. But if we understand what it is and take a look at it, we're going to have a better understanding of what might happen with our dentistry down the road to help things be more predictable. And really, even if we wanted that to be the case, it's not even possible for every patient because many patients have some joint issues that are out of our control, whether it be some type of arthritis or other deformities. We can't even use centric relation. So it's not even for every patient, even if we wanted it to be. So identifying centric relation, as we spoke earlier, is by actually using the elevator muscles to put the ball up into the socket and allowing the lateral pterygoid to release. And how do we do that? Well, as you can see here, we've been doing it for a long time. I put these old pictures here for a reason because this is nothing new. We've been using a leaf gauge or anterior deprogrammer for years. And how it works, and you probably use it in your office, is the leaf gauge has a bunch of plastic leaves and you slide the jaw forward. And what it does when you slide your mandible forward on it is it takes the ball completely out of the socket. Everything is messed up when we move forward. But when we move back on the leaf gauge the other way and squeeze, it actually shoves the ball up into the socket and keeps the teeth out of play, right? And this is also when we're loading the joint, as we talked about earlier. So at the same time we are getting into centric relation, we're always loading the joint and asking the patient if there's tension, tenderness, or discomfort. So you can use a leaf gauge or a Lucia jig or anterior deprogrammer you might be familiar with. It's the same thing, sliding forward, back, and squeeze. And what you can see from this photo here is all that space that's left in there is the perfect amount of space to put in some bite registration material and take a record of what teeth are touching in centric relation, or what teeth are touching when the ball is in the socket. And it might not be all of them, but it's sure an opportunity for us to take a look at what does touch when we are in centric relation. So you might find that when you're taking records or trying to get people into centric relation to evaluate that position, that it's sometimes uncomfortable. So why would it be uncomfortable for a patient to be in what we think is the most orthopedically stable position? It doesn't make sense, right? If it's an orthopedically stable position, it should feel good. Well, oftentimes it's that darn lateral pterygoid again. It always gets the blame. So you have to remember that the job of the lateral pterygoid is to pull the mandible forward. And if that lateral pterygoid is 24 hours a day basically being pulled forward because our teeth are interdigitating slightly forward of the ball being in the socket, then that muscle is so used to being pulled forward, so used to contracting on a regular basis. And when we try and release that muscle, it is not used to it. It's almost having a muscle cramp. So we're asking that muscle to release so the ball can go into the socket, and it doesn't even know what to do. And that can create some discomfort on a regular basis. So another way to look at that is to look at this figure here, the skull, and you can see that the teeth are interdigitated, right? So in maximum intercuspation. And again, when that's there, the lateral pterygoid is actually pulling everything forward. And when the mandible actually wants to go up and the ball goes into the socket, the lateral pterygoid has to give up a little bit, and that doesn't feel so good. So just another little diagram of what happens when we're trying to get the ball into the socket and what the role of the lateral pterygoid is. Another reason that it might feel uncomfortable for a patient to go into this centric relation position is really that there is something going on inside of the joint, and so the ball is being pushed into that retrodiscal tissue as we discussed earlier. Another reason that you might feel discomfort when trying to be placed into this centric relation position is an actual derangement of the joint. So really something actually going on in the joint, whether it be the ball or the socket or some bony deformities, but something going on inside of the ball and socket, and might even be some type of arthritis. And the third reason then is just oftentimes, as we talked about, it's the ball being shoved into that retrodiscal tissue, and that can create comfort. So again, the three reasons that it might be uncomfortable to be placed or manipulated, if you will, into centric relation is mostly the lateral pterygoid, sometimes a derangement of the joint, or impingement on the retrodiscal tissue. But otherwise, it is the orthopedically stable position, and we should always evaluate that as well. So in this course, we've taken the time to, again, re-identify the four components of the masticatory system. And then we've taken a closer look at the joints or the anatomy of the joints. We've then talked about the exam and gone down the exam and what we're looking at with respect to what's going on with the anatomy during the exam. And we took a really pretty good close look at function and dysfunction of the joints. And finally, it seemed appropriate to spend a few minutes talking about centric relation. A lot of information on the joints that I hope is helpful for you, and you can always refer back to it now. I've had a good time going over it with you. Thanks for your time, and I'll see you at the next course.